A drug addict goes to the ER for one overdose, and the nurses, I've seen this in real life, will say, next time shoot a little bit more so we don't have to see you. I've seen nurses like this. I've gone toe to toe with this type of stuff. Hey everybody, my name's Jake Spellis with Vital Health. I'm the current CEO and have about 10 plus years experience in the field. Today I want to talk about the cost of treatment. You know, one thing I've always learned in school and any programs, like, hey, why can't we help the kids? Why can't we have elderly? You know, why can't we just feed everybody in the world? The answer is always D, money is the real solution. You know, some people I see that they think money just trickles down. So let's say you're a parent trying to get your son, daughter, loved ones enrolled in treatment. Let's say you're just a homeless addict or somebody getting out of prison. You're like, how do I afford treatment? You know, I want to know help. One of the things I like to open up first with is like, how much does untreated addiction? So, you know, Medicaid and Medicare, insurance companies typically spend, you know, about $11.2 billion a year on treatment, which sounds crazy. You know, some markets will say that the treatment industry is about $30 billion a year. So I guess there's a lot of money. I think the most important thing is to realize this number, that untreated substance use disorders cost the economy $600 billion. You know, law enforcement, jails, unemployment, costs a lot. I've seen a lot of studies on the effects of the economy just in my local area. There's studies about $1 billion, you know, just on people taken out. You know, think about it, you know, especially during the opiate epidemic, you know, if you're all messed up on Percocets and stuff, you know, your first thing is probably not to work after you get so far. You know, I want to break down to you, you know, I see, you know, the income and stuff associated with my treatment center. You know, I work with a lot of people that don't have insurance. One, I want to talk about why it costs so much. This business, the biggest thing is human capital. Profit margins, you know, typically depend on how many providers. Doctors go to school, what, 12 to 15 years to get their degree. So they don't want to be paid, you know, $12 an hour. You're paying for their expertise, right? If you put mustard on a hamburger versus fixing a brain, there's probably a pay difference right there, you know? You know, most people don't understand that concept for some reason. There's so many ways to pay for treatment. Obviously, the biggest funder that we have is Medicaid. Medicaid is a state insurance due to your income. And believe it or not, you know, homeless people using heroin right now don't have that much money. Next thing would be Medicare. So you might have people that are over a certain age that get Medicare, or you have people that's on disability that gets in thing. Next would be commercial insurance. So let's say you have a job and you're drinking the booze too much on the weekend, and you know, you have the forklift and you just drive it into somebody, you get DUI. The boss is nice, probably not realistic, but they're like, hey, I need you to get treatment. They might have programs built into it. So it might be employee assistance program. They might say, hey, you know, we're going to suspend your forklift driver's license due to you knocking over everybody in the factory. Your insurance company has contracts with each and every treatment facility. They might pay for a percentage, you know, so let's say, you know, they go and get counseling, there's a certain fee. They go and get group therapy. They go and see a doctor, just like any other healthcare model. And then there's cash payers. Maybe you got some rich parents in Beverly Hills and they're like, hey, you need to stop snorting your Adderall, Timmy, and you need to go get help right now. I'll give you $100,000 to go get treatment. I will say, you know, in my opinion, I do think there's a disparity in the amount that you get paid in proportion. For example, mental health. People don't really care about that type of services, paid in proportion to other specialties and stuff. Substance abuse treatment, we're kind of on the lower end. And I always hear like, why are we wasting all this money? Well, you might have Gerald who goes to the ER, both legs chopped off with a bag of Mountain Dew and some McDonald's, and people don't say nothing about that. Gerald keeps eating a load of fast food every day and he's drinking bacon grease, but he can go to the ER 14 times, they don't say nothing. A drug addict goes to the ER for one overdose, and the nurses, I've seen this in real life, will say, next time shoot a little bit more so we don't have to see you. I've seen nurses like this. I've gone toe to toe with this type of stuff. And it's like, you want to say that to Gerald, your cousin with the legs chopped off, drinking Mountain Dew, bacon grease, right? Typically where you go depends. So detox and hospitals obviously being the most amount of money because they have so many staff there. They're treating you at the highest level of care that you have. Medicine's normally needed. Other medical procedures are done. You know, in some instances, they don't really make money, they just break even. I know that's a hard concept to grasp, but you know, they might only break even because of the IV drips they gotta give you and they gotta pay for that stuff. You have 2-3 doctors, you have a medical director. It costs a lot of money. Insurances that you have to keep, like malpractice, liability, professional, licensures. You know, these are all costs, you know, overhead space. There's a lot of costs that goes into running a facility. Like, you know, for example, when I've started my facility, insurance companies didn't pay us for like 5 to 6 months, and then a lot of them kind of got over on us and still never paid us to this day. A social worker might make $25 an hour, and they got to work 40 hours a week to serve people, you know. And for counseling sessions, you know, in some cases, Medicaid might only pay as low as $60 up to $100. So, you know, you can see the small frame on that. You can see why a lot of doctors have to see so many patients to barely make it even. You know, it's kind of like the movie theaters. You know how I look at it in some sense. You know, it's like they make, you know, no money on the tickets, a lot of the money in the secondhand stuff. You know, I would imagine a lot of places don't make a lot of money on the doctors from other expenses, but you make money in all the other services. There's a lot of local boards that are tax funded as well. Toledo, we have one. All the other, maybe we have 88 counties or something like that. They raise money on a levy to pull off a percentage of the property taxes that pays for certain services too, to cover people with no insurance. So you might go to a treatment center or a local nonprofit and they'll help you out there. There's federal health centers that have a pay scale, so they might serve people who are undocumented, or they might serve people that live in, you know, just right over poverty, but that, you know, one little medical bill will take them out the game. So instead of paying, let's say $100 for a doctor visit, they give you a slide schedule of 20. Again, there's still no magic tree of money throwing down that pays that. You know, typically sometimes the provider has to take the loss, or there's grants that make up the difference. I will say Ohio does a really good job. You know, we just had a Medicaid expansion not too long ago. They gave access to everybody. You know, I know in Ohio, if every addict right now went into treatment, we only have enough space and providers for 18% of the population. I'm not saying Medicaid is like the best system, or commercial, or Medicare, you know, but sometimes you never get paid. It always seems to be the patient that has the conspiracy. When you call my phone today, what you get, $10,000? And I always tell them, yeah, that's how much we got, Billy. We got $10,000 to talk to you about not smoking some ganja. I think it's important to realize that, one, I think this whole conversation, you know, is a stigma associated. Here's Timmy right now calling. It's a $10,000 phone call, but you know, it's really important to know it's like the stigma associated. And of course, people that cure cancer, people that help cancer would get paid more than, you know, changing your brain about anxiety and stuff like that. If you look at some of the other specialties, you know, I'll see a doctor visit, they'll get $400 or $500 for a $7 visit. Mental health, you might make a very small fraction of that. Detox typically costs, I can say for like a 10-day detox, I think Medicaid might pay out $3,000 to $4,000, you know, and private insurance can pay about like $10,000 to $20,000. So you can see a little disparity in that stuff. Residential treatment, you know, will cost sometimes up to $30,000 to $50,000 a month, sometimes more. But you know, just remember all-time lights, staff in the places. Somebody being outpatient for 6 weeks can cost anywhere from $20,000 over the 6-week time. You know, counseling sessions typically cost anywhere from $88 to, if you're paying cash, maybe $150. There's a lot of different factors that go into that, you know, your insurance, deductibles, and stuff like that, but that's typically how the cost is associated, and then associated with your level of care. Like, we're just stepping out of the hospital, coming to a partial hospitalization is gonna cost more than obviously one counseling session. My name is Jacob Spellis of Vital Health, and this is our little video on treatment costs, and typically how providers get paid and how you could pay for treatment yourself.